spike in COVID cases in at least 5 states, raising concerns about a next new wave of coronavirus. Indian government has announced the guidelines for second phase of the vaccination drive. From 1st of March, people above 45 years of age with comorbidities and everyone above 60 years of age will be eligible for getting the jab. To speed up the process, participation of private sector has been allowed as well. How will this work? How can you or your family find out whether you are eligible to get the vaccine or not? Let's find out on India Revival Mission Council. I am Hina Gambhir, and joining us today is Dr. Naresh Trehan, who is Chairman and Managing Director of Medanta. We have with us Dr. N.K. Arora, who is Chair, COVID Subcommittee of National Technical Advisory Group on Immunization, Dr. Ashok Seth, who is Padma Bhushan and Chairman of Fortis Escorts Heart Institute, and we also have with us Dr. Anant Bhan, who is researcher at Global Health Bioethics. Thank you very much, all of you, for joining us here on India Revival Mission. Dr. Arora, let me begin this discussion with you. People are really looking forward to this next phase of the vaccination drive. I want to ask you, what will be the registration process? Who all are going to be eligible?
The important point here is that we must expand the immunized base as soon as possible, and therefore we are now entering into the next phase where above 60 years anybody with or without morbidity are given the vaccine. It is estimated about 6 to 7% of people are there in the age group of 60 years and above. So in other words, it translates into about 10 crore individuals.
Okay.
And it is estimated that about 60 to 75% of them may have other comorbidities, and that is why this cutoff that it's a very high comorbidity age group, so that they will benefit, and it can be of any kind. Currently, the process is that the private sector has been invited, and it is such a great feeling that it's a good example of public sector and private sector working together, the common goal, so that we have a large number of immunized individuals. The CoWIN app will be used for registration, and that will show the individual which is the nearest immunization center to their house location, or they can choose the immunization center of their choice also. And as I understand last evening, probably this will go live, COVID app will go live by tomorrow or day after. So by 1st it should be available. The initial hiccups have been taken care of, but there might be still, it's a software. So some alternate mechanisms have also been thought of, and even the immunization centers have been allowed flexibility to enroll people using the appropriate screening criteria, which I'm sure they will be getting soon.
Okay.
So that is one category of people. The second category of people is those who are above 45 years and are suffering from serious comorbidities. And for this, they will have to get a certificate from their treating physician. And all the comorbidities we have been talking about, whether it is heart disease, chronic lung disease, liver disease, pulmonary disorders, kidney disorders, or diabetes, hypertension, cancers, those on immunosuppressive therapy for autoimmune disorders, let's say, they will be all eligible. They will get the certificate, and on the basis of that, they will also be registered for vaccine. The third thing is that many times we have to always remember that each one has to get 2 doses, and that's why documentation of the first dose, monitoring them after the first dose, and then inviting them for the second dose at the appropriate time, and then following them up for any other adverse events. This is an integral part, and our experience of last 37, 38 days has shown that the private sector has done a great job.
Okay.
There were about 2,000 plus sites, and where private sector administered the vaccine, and it was very well managed, and that's why this exponential 10 times increase in the immunization centers in the private sector.
Okay, so you explained to our viewers very nicely the kind of process that will be followed, that they will have to now ensure in case they're above 45 years of age with comorbidities, or they're above 60 years of age, what exactly they will have to do. Of course, they'll have the option to pick the center that they want to go to. Dr. Trehan, I want to ask you, how critical is this phase really going to be, and the role that private sector is going to play here, because now at least 5 states have suddenly started seeing a sudden spike in coronavirus cases. So what can really be done that people come out in large numbers to get themselves vaccinated?
So, this has been a great concern around the society, especially the elderly who have had comorbidities. You can talk about, like, we have several million patients who are being treated at hospitals already. And their anxiety levels were so high that, it looks like another wave is coming. We are sequestered here for the whole year. Can we get infected? So all those fears will now start wearing off, because that demand was coming from that group of people on a daily basis. So the government has recognized, and that, like Dr. Arora has outlined very nicely, that what is the sequence and thinking of the government. And we already have experience of public-private partnership in the testing phase of COVID. We know that we all participated together, not only in testing, in providing the hospital facilities. All those things were done in a very cooperative manner in this whole experience of last year. So this is only extending that whole experience, and the fact that there were some issues which have been resolved, and that one concern of the government was that if we let it out in the private place, will people do profiteering?
Okay, very interesting. Dr. Ashok Seth, now as Dr. Trehan also mentioned, that there was anxiety, but we've also seen that how many people have been wanting to actually pay and get the vaccine, the way the numbers are spreading, and concerns were raised when India was exporting or sending more outside than actually giving here in India to frontline workers and to healthcare workers. But what if there is a sudden rush of people, because there are so many who are willing to pay and get the jab? How is everyone going to then manage this sudden rush? Is there going to be some sort of a priority criteria that you will follow? I mean, how will it really work?
So let me first address one of the important issues that we must keep saying, and that is that the public and the private partnership, COVID gave us an opportune moment to get this together over the last 1 year. And what it's done is created trust and a confidence amongst the two parties, because truly this was done. The public partnership and the private partnership came in on a trust of nationalism and being socially responsible. And we've seen many examples of that, not just the testing part of it, but even the inpatients, the bed augmentation, the ICU augmentation, be it even, say, ventilator augmentation. So we did a great job. And this trust is and the present partnership of vaccination augmentation is truly a continuum of the same process. But another important point that I must visit. We look at the positives of it first, and then we could discuss the negatives also and the concerns. But the biggest concern is that COVID is showing its head again. We thought we had won one battle, but truly the war is ahead. We see the numbers rising. We worried about the second wave. We worried also and concerned about the mutations and the variants of COVID strains which would be coming in. And perhaps if that comes in with more viciousness, we would again be perhaps in a situation of our bed strength and our ICU strength having to be again ramped up. We don't want to be in that situation. And the only weapon we have at the moment is vaccination. You already knew that we have a 5 crore stockpile of at the Serum Institute of India of the Covishield. Bharat Biotech is ready with another stockpile the moment the third phase study comes into being. So we actually have only used up a quarter of the stockpile which exists, and both these companies have the ability to ramp up. Right around the corner is approvals for a third vaccine, in India. Of course, the Sputnik with again Dr. Reddy lab ready to ramp up its production, and then we'll have another 2 vaccines around the corner in 3 or 4 months.
Right.
So I don't think we will have a poor availability of vaccine because India is the vaccination hub in the world. It manufactures the largest amount of vaccine. In fact, the reason export is going is because we're not using enough of those at the moment. And that's the saddest point, I think, to understand. Truly, we're not worried about what comes out of it. Remember, test pricing was capped. Nobody complained about it.
Absolutely. Dr. Anant Vahan, you know, at this stage of our fight against coronavirus, do you think this is the best that India could do to allow private sector? Over 20,000 centers of private, hospitals will be part of this vaccination drive. Do you think with this we will be able to reach that target of about 50,000 sessions per day?
Thank you, Reena, for inviting me. So yeah, this is, we are at a stage in the pandemic where it's really important for us to ramp up our vaccination efforts. And the private sector, as already described by all the esteemed panel members, has been a key partner over the last many months. That having been said, I think there are a few concerns which also probably need to be addressed. One, the vaccines are now available under restricted emergency use authorization permissions, and if we allow for these vaccines to be sold in the private market, then we have to also clarify: are we considering it as equivalent to full licensure? Because typically that is where you allow for sale of vaccines to happen. So far, it's only been used in a high, in a section of the population which is at high risk. The second thing is we have to recognize there is an inequity in the health system. Both public and private facilities are largely in India concentrated in urban areas. And in this case, if we have the private sector adding on, then we might actually have a situation where you have much more vaccination delivery points in urban centers, but relatively much less vaccine delivery points in rural areas. And that would require some thinking and planning about how do we make sure that our rural areas are not underserved in our vaccination efforts. Because that is where a lot of the need might lie, because a lot of exposure to infection has happened in urban areas, not so much in rural areas. The third thing is, if I'm middle class, upper class, if I have access to funds, I could easily go to a private center and get vaccinated, but I might have to wait for my turn in the public sector. So is there a concern around being able to jump the queue, because now you also have availability in the private sector? And finally, how are we going to ensure that adverse event monitoring, which is an important part of rolling out vaccines, especially in RU mode, is being followed? So I think all of these things are important things.
Very important concerns you've raised. Let's get Dr. N.K. Arora to respond to the concerns that you've raised. Dr. Arora, will you like to address some of those?
So Anant has raised 2 or 3 very important points. One is the issue of distribution of these immunization centers. And as one can make out, these 20,000 immunization centers mostly will be in urban habitations, because that's where the hospitals, nursing homes are located, most of it. But if we look at the pandemic, the bulk of the infection is also in the urban areas. The transmission intensity is highest in these areas. And that is why the support from private sector will be immensely valuable, that they complement. And we also have to accept that the government health system is not robust enough in urban areas. So they are the most logical and most relevant stakeholders or partners. And if you look at the dynamics of infection based on seroepidemiology, if we have one infection in the rural area, there are at least 2 people infected in urban areas and 4 people infected in urban slums. So you can make out at an average 1:3 ratio exists between urban and rural area. So that is why this seemingly disproportionate representation of urban area is a high-risk priority, which Anant has very nicely understands, and that is one of the focus. But wait, there is something else coming in, because rural area is not being forgotten. So 10,000 at the moment are wherever they are, but rapidly they are likely to be ramped up to around 50,000 immunization centers. And most of these will be rural area. We all know that rural public health system is very robust. And in fact, India has the capacity to go up to 100,000 immunization centers across the country, and most of it is in the rural area. Another important thing we must remember that India has the capacity, and we have been doing it. We did it last week also. That on a national immunization day for polio, we immunize 17 crore children in 1 week. Its coverage is almost 99% or 98%. So one may say it is oral doses, but no, the question is you're touching base with 17 crore mouths. And therefore, rural expansion is going to happen very rapidly as soon as things stabilize in this private sector and the other areas, then rural area will be. So that every section of the population, every region, accessible, inaccessible, remote Arunachal Pradesh, Nagaland, or anywhere else in the country, or in Chhattisgarh, every area will be covered.
I think
that is how we will be able to cover 30 crores in next 3 or 4 months.
Target is 30 crore in the next 3 or 4 months. I have very little time, but I want to quickly go across to Dr. Trehan as well with one last question. And there are 2 quick concerns that I want to raise. One, everyone that we speak to around us are a little worried because there are reports of people, falling sick. There are reports of people dying as well. And, most of them suggest that they died after getting vaccinated. But the number is pretty less, but there's still a bit of a concern. So how can we address that? Second, like in the second phase, a choice has been given for an individual to pick a center of his or her choice. Do you think a choice should be given to pick the particular vaccine that a person wants?
So, very good questions, both of them. The first thing, I would like to strike a note of caution here. In our enthusiasm to ramp up, we must not compromise safety. The experience of the doctors and the healthcare workers has given us some data, but don't forget they are all healthy people or mostly healthy people. Now we are taking on a group which is elderly with comorbidities. So we do not know what kind of reactions we will have, hopefully very little, but this ramp up has to be, even in private hands, done in a calibrated manner that we must observe them for the next 30 to 40 minutes, especially people at high risk, so that the churning is not like you're turning it out like a factory. You are moving in batches, you inoculate whatever your capacity is for the observation and the beds that you have made available in case any problem occurs. And then we will be able to maintain the safety and the follow-up of the patient.
Right.
So, rightfully, the government is thinking, and as Dr. Arora has already elucidated, that this is a very big effort, but in case we need, we will allow, like we did in testing, that the testing was done and we used to load the data every day on the ICMR site. Similarly, if the app is not able to take on 1 crore people at the same time, let the hospitals do within the 4 corners of the parameters set by the government, follow the protocol, load it in their own computers, and then upload it on the COVID app. That will make it much simpler and much less load on the COVID system. 1. 2, about the choice.
Yes.
You see, this is desirable by everybody, I'm sure, because they would like to pick and choose, but it's not recommended at this stage. Because every area should get the same vaccine because 2 doses have to be given.
All right.
So you can't mix and match because there is shortage of one or you got the other and then this is available or not available. Let the government decide. Although it is said that millions and zillions of doses are available, let the government confirm that.
So you believe that this is not the right stage for the government to give that choice to the individuals to pick the vaccine that they want. It's quite an early stage that we are still into. Thank you very much, all of you, for joining us.
And all of them are safe.
All of them are safe. That's the message.
So that there's no panic around that.
So don't panic. All of them are safe. That's what the...
Hina, no interchangeability of vaccine is allowed. I think that what Dr. Teeran is saying is all music.
Yes.
We have to be careful. No interchangeability is allowed, and all the vaccines are safe. So one should not be very worried about which vaccine are you taking.
Okay, so don't worry. That's the message coming from the top doctors in the country for you, and I hope their answers helped clear all your doubts as well about the vaccination phase that's going to kickstart from 1st of March. Thank you very much, all of you gentlemen, for joining us here on India Revival Mission.